Chikungunya fever is an acute viral disease caused by the chikungunya virus. The disease was first recognized in Eastern Africa in the 1950s and has since become endemic in many parts of the tropics. Outbreaks have occurred in recent years in various regions, including Africa, Southeast Asia, South Asia, for example, India and Sri Lanka, and the Indian Ocean Islands. Additionally, outbreaks were reported in Malaysia and Indonesia in 2006, and imported cases have been documented in Europe, the United States, South America, and Asia, among travelers returning from chikungunya-affected areas. Chikungunya virus is primarily transmitted to humans through the bite of an infected mosquito, with Aedes albopictus being the main vector in Singapore. This mosquito species is also capable of transmitting dengue fever. While other mosquitoes like Aedes aegypti can also transmit the disease, there is no direct person-to-person transmission of the virus. Monkeys and possibly other wild animals may serve as reservoirs for the virus, allowing infected mosquitoes to spread the virus to humans when they bite. Chikungunya fever is characterized by a sudden onset of symptoms, including fever, chills, headache, nausea, vomiting, joint pain with or without swelling, and low back pain. Some patients may develop a rash affecting the trunk and limbs. The illness is usually self-limiting, with most symptoms lasting for 3-10 days. However, joint pain may persist for weeks to months. Unlike dengue fever, there is no conclusive documented evidence of severe bleeding, nervous system involvement, or fatalities associated with chikungunya virus infection. The typical incubation period for chikungunya fever ranges from 1 to 12 days, with an average duration of 3-7 days. Currently, there is no specific antiviral treatment for chikungunya fever. Management typically involves supportive care, including bed rest, fluid replacement, and medications for fever and pain relief. It is advised to avoid aspirin as it can increase the risk of bleeding. In more severe cases, hospitalization may be necessary to reduce the risk of contracting chikungunya fever while traveling to outbreak areas. Individuals should take preventive measures to minimize mosquito bites. This includes wearing long-sleeved shirts and long pants treated with repellents, using mosquito coils and electric vapor mats, and applying insect repellent to exposed skin areas. Additionally, travelers are encouraged to stay indoors or sleep under mosquito nets during the initial days of illness to prevent further transmission of the virus.